Eczema, also known as atopic dermatitis, is much more than just dry, itchy skin. It is a chronic inflammatory skin disorder that comes and goes in flares, and it can affect patients for years. What makes eczema fascinating from a medical perspective is that it reflects a deeper problem, a combination of skin barrier weakness and an overactive immune system. This condition doesn't stand alone. Many patients with eczema also develop other allergic conditions, such as asthma or allergic rhinitis. When these occur together, we refer to them as forms of atopy. That's why eczema is often considered part of a broader allergic tendency, not just a skin problem.
Now, let's understand what really happens.
The key problem lies in the skin barrier. Normally, proteins like filaggrin keep the skin intact, reducing water loss and blocking allergens and microbes. In atopic dermatitis, mutations in the filaggrin gene weaken the barrier, making the skin dry, cracked, and permeable. Allergens and irritants can then enter, activating the immune system. The Th2 immune pathway becomes dominant, releasing interleukin-4 and interleukin-13. These cytokines stimulate B cells to produce IgE, which explains why patients often have high IgE levels and associated allergic conditions. This immunoglobulin production ultimately drives inflammation within the skin tissue, leading to the characteristic symptoms of this condition. Eczema is also one of the most common skin diseases worldwide. It affects up to 20% of children and up to 10% of adults, especially in industrialized countries. Most cases begin early in childhood, often before the age of 5, and many children with eczema go on to develop other allergic conditions later in life. The appearance of eczema changes with time and age. It is a long-term condition that flares, calms down, and flares again. Mild cases may resolve on their own, but moderate to severe disease usually needs treatment. In the acute stage, the skin is red, swollen, and very itchy, sometimes oozing fluid or forming yellow crusts. In the subacute stage, lesions dry and become scaly. In the chronic stage, scratching causes thickened skin with exaggerated lines, a process called lichenification, and pigmentation changes may appear. The distribution depends on age. In infants, eczema often affects the cheeks, scalp, and extensor surfaces of the arms and legs, sparing the diaper area. In children and adolescents, lesions shift to the flexural areas such as elbows, knees, and the sides of the neck. In adults, the disease becomes more localized and chronic, frequently affecting the hands, eyelids, and flexural surfaces. These lesions are often thicker, cracked, and resistant to treatment. Eczema is not only about the skin. The itching can disrupt sleep and concentration, while repeated scratching increases the risk of bacterial infections, most often due to Staphylococcus aureus. Severe cases may even lead to eczema herpeticum, a widespread viral infection.
So, how do we treat this condition?
Treatment starts with emollients to hydrate the skin and restore the barrier. During flares, topical corticosteroids are first-line therapy. On sensitive areas such as the face or eyelids, topical calcineurin inhibitors like tacrolimus are preferred. In more severe or widespread cases, systemic therapy may be required, including immunosuppressants such as cyclosporin, methotrexate, or azathioprine. New biologics like dupilumab, which block interleukin-4 and interleukin-13, have proven highly effective for severe resistant eczema. With that being said, I hope this explanation helped clarify eczema. If you found this video useful, don't forget to like, comment, and subscribe for more medical content. Thanks for watching, and see you in the next one.